I'm usually sort of awestruck by conferences like this because there's just so much that's being done in adults that is so far beyond where we are with young patients that I think it's usually really interesting. I'm always interested in hearing about inflammation in MPN, so I know Dr. Fleischman will be speaking about that, and that's a topic I think is really interesting. I think hearing about thrombotic complications in MPN patients as a hematologist is really interesting to me, so I'm looking forward to that group of topics. I know specifically there's a discussion on COVID-19 and thrombosis in MPN patients, so I think that'll be really interesting. And just, given the current climate, I think hearing more about COVID and MPNs in general will be really interesting and helpful for me as a clinician to care for my patients. And then I'm always, really excited to hear about new drugs coming down the pipeline, because the more drugs we get for adults, the more drugs we might get to use for children and more options to offer families. So I think hearing about the different therapies and transplant versus drugs, I think will be really important so that I can better counsel patients. I think it's great that we now sort of have a pediatric voice in the MPN world, and I think these are a rare subset of a rare disease group. So I think when you're the rarest of the rare, it's a little tricky sometimes. But I know that the patients and their families are just so interested and dedicated to helping research happen and wanting to sign up for studies and wanting to be made aware of trials or new data that comes out. I think it's really a testament to these families and these kids who want to help other patients and want to help the field grow. So I think it's great that over the past couple of years, we've started having talks on young patients, that there's more data coming out on young adult and pediatric patients. And I think it'll really help our care of these patients. And I think it'll really help move the field forward.